work with local industry and get it's something that makes us more sellable as a service, I would say. So we actually work with a large local employer here to provide vocational rehab services in the way that we, exactly the same way as we do for our NHS patients, but for them in industry. And there are private providers out there that do workplace assessments that will do a functional capacity assessment to understand someone's work capacity. We already do that for our NHS patients anyway. But the thing that we do, obviously, that not everybody else can do, is the rehab. So when you go into somebody's workplace and identify that there are aspects of the job that they can't do, you've got two choices then. You can either say, okay, so they can't do it ever, someone else is going to have to do that, or that piece of equipment doesn't really work in this situation for that person. We're going to have to invest in some sort of equipment to enable them to do the job. Or you could say, actually, why can't that patient do that? Why can't that employee do that? Is there anything we can do to make them more able to do that? So through rehabilitation, can we get it so that they are stronger, they're fitter, sometimes we get referrals of people where it's a specific injury that they've had, which means that they can't do their job, which again then makes it very similar to the work we do here. But sometimes, people work in long shifts, they've done the same job, they're coming towards retirement age, and they just don't have the physical capacity to do that job for 12 hours, 3-4 times a week. So the other way of looking at it is, can we make sure that they're able to do that through rehabilitation? And I think that part of it, compared to private providers, makes us that little bit more unique. And if anything, that was the thing that took off the most, because this is a understanding at that point. And they only started to get interested when it started to generate quite a lot of income. And then the answer, which is fairly typical of the NHS, is then to put a target on that. Okay, so you earned that last year, let's earn more next year. The one thing that we did get on the back of that was an extra member of staff. And also we got a little bit of slack on our cost improvement targets, because rather than us saving money, we made money, if that makes sense. So it kind of got them off our back in that respect for a little while. But I think, so in the first year, I think we only made about £12,000 off that contract. But by year 3, it was £56,000. So to me, £12,000 is a lot, but obviously in the grand scheme of things, it's not. So, but at the point where it started to actually pay for a full member of staff and some, then I think there was a little bit more interest. But certainly